morning and welcome back, everyone. It's about 12 minutes before 7 o'clock. Joining us this morning from Gunderson Health System is Nate Farley, here to talk about sleep apnea and some of the oral appliances available to help folks sleep more comfortably. Nate, thanks for joining us this morning.
Thank you.
So sleep apnea is what we're talking about. First off, for people who might not know, can you give us a brief rundown of what is sleep apnea and how does it affect folks?
Sure. Obstructive sleep apnea is when during sleep your anatomy closes your airway off, preventing you from being able to breathe properly. Basically, you're not getting enough oxygen to your lungs.
And it affects a number of people, causing problems not only at night but during the day as well. We talk about appliances to help people. What are some of those? Can you kind of describe what they are and how they help?
Sure. The gold standard for treating obstructive sleep apnea is a CPAP. It's a machine that you wear, a mask that pushes the air. A lot of people struggle to wear that mask through the night for various reasons. So one of the options that we provide is these oral appliances. An oral appliance, what it's doing is it's taking your lower jaw or your tongue and it's trying to pull it forward to keep that anatomy lifted up off the airway. And so you would just wear these two pieces in your mouth during the night, similar to wearing a retainer.
Now, how comfortable is something like that to use for people?
Surprisingly, people do really well with them. Most people find them much more comfortable than the mask. People don't like having all that on their face and the straps that go around their heads, so something in their mouth people do very well with.
And are these retainer-like appliances as effective as the mask?
Unfortunately not.
Okay.
If people have mild to moderate sleep apnea, research has supported their effectiveness. But for people with severe sleep apnea, they would be better off with a CPAP, though some people still can't tolerate a CPAP, so it is still a good alternative in that it's better than nothing.
Yeah. Now, how do people know they might have sleep apnea, and what should they do when they see some of the signs?
Right. So if somebody is suspicious that they might have sleep apnea, meaning they're tired during the day, people catch them in their sleep, gasping for air, the first step would be to see the sleep center. Gunderson does have a sleep center here, and they have a sleep study done where they're monitored while they sleep. And from that information, they're able to get a diagnosis of sleep apnea and its severity.
All right, so just a couple of things to be on the lookout for: that sleepiness during the day, the struggling to breathe at night, those kind of the main symptoms here we're looking at?
Definitely.
All right, Nate Farley, thank you so much for joining us this morning to talk a little bit more about sleep apnea and the possible solutions.